Welcome to Health Professional Radio. I'm your host, Neil Howard. Thanks so much for joining us again. Going to be having a conversation with Mr. Jiang Li. He's founder and CEO of VivaLNK. It's a provider of connected healthcare solutions. He's joining us to talk about a partnership with Mazzetti. Now, Mazzetti is a provider of healthcare building systems engineering solutions. Welcome to Health Professional Radio, Mr. Jiang Li, and thank you.
Thank you, Neil. Thank you for having me here. Viva in Spanish, there's meaning of life. Basically, the company name is VivaLNK. We want to link the physical world to the digital world to make that connection. That's why we call it VivaLNK.
Are you a healthcare provider? What is your area of expertise? Is it in engineering?
Oh yeah, myself. My background actually came from engineering. Actually, I started my career as chemical engineering, working in semiconductor industry. Then later on, I moved into sensor and IoT space, and then afterwards, I started this company, VivaLNK, in 2014.
Now, as a provider of connected healthcare solutions, what is a connected healthcare solution?
So, connected really means is that the patient or user's information is always available to the service providers like the doctors or physicians. So that means it's connected. Healthcare solution, obviously healthcare, everybody understands. Solution meaning we're offering the entire kit, including the sensor, including the connectivity service, and including the some of the cloud analytics as well.
So all of this information, the gathering of this information, you're providing the network, as it were, in a one complete kit, all in one. Correct.
And you can think of us as a human vital information delivery system, right? So we have our own unique sensors, which gathers the medical grade vital information from human body continuously. And then we transmit wirelessly via Bluetooth, then from edge devices, then pass the information onto cloud, and then later on deliver to physicians.
Now, are we talking about one sensor for each function that's to be monitored, or one for all of the systems that are to be monitored?
Sure. Yeah, very good question. So we do have a collection of multiple sensors to be able to assess all the basic human vitals. So the basic human vitals, including body temperature, ECG, heart rate, respiration rate, SpO2, and we're also in the process of integrating some other important vitals in there.
You've teamed up with a company, Mazzeti. Talk about this collaboration and how it, I guess, even expands more on the connected healthcare solution.
So Mazzeti is a very good company. I will call them as a system integrator, which is what their role in this case is they help us to deploy our system into healthcare facilities. Mazzeti is the world's first use of medical wearable for COVID patient monitoring in hospital. So that put us as the first time in the world actually to do this. In one particular case, we worked with them was deploying our vital monitoring system in the field hospital in Los Angeles. So because we developed this vital monitoring system for in-hospital monitoring, so Mazzeti was the company help us deploy the solution into the Los Angeles Field Hospital.
This monitoring due to the COVID-19 pandemic, the technology was already in place. You had your technology, Mazzeti had theirs. As you said, we see a lot of these pop-up healthcare facilities in anticipation of an influx of COVID-19 patients. Are we talking about setting up the facility and already having all of the sensors in place in that pop-up facility, whether it be on a college campus, in a super center parking lot, or wherever?
Yes, practically, because this system is very, very simple and very lightweight, if you will, as far as on physical footprint. Because our sensors, I did not give you an introduction earlier, our sensors are very small, very easy to put onto the human body. And then once they put onto the human body, they can gather the human vital continuously 24/7 and then transmit the data wirelessly into a edge device. Mm-hmm. So this makes the whole system very easy to be deployed in those situations you were just describing, whether it's a pop-up center or in a field hospital.
When it comes to monitoring, say, temperatures that can fluctuate quite dramatically based on the condition that a person presents, maybe it's COVID-19, maybe it's something totally different. How sensitive and accurate are these wearable sensors?
So these wearable sensors that in our system, they are all medical grade sensor, which already received FDA clearance. And we also actually have multiple medical institutions using them, so their accuracy is very high and it's definitely sufficient for this type of monitoring.
So to be clear, this collaboration with Mazzeti, how did it come about, and what is the ultimate goal with this collaboration?
As we know, to deploy this type of system into a wider range of application cases, whether in hospital or in nursing home or different places. So our company is a small company, right? So we don't have enough manpower to do all those on-site deployments. And Mazzeti, they are a very reputable company. They have very good experience about deploying IT system and IoT infrastructure into the hospital environment. So that's why we team up. So the responsibility here is that we offer the solution we mentioned earlier, and then Mazzeti is in charge of deployment in facility.
Well, where can we learn more about VivaLNK online and about this collaboration with Mazzeti?
Yeah, so actually, as far as the VivaLNK information, you definitely can find more info on our website. And furthermore, you can do a quick Google search about news about VivaLNK, and then there will be articles coming up. And as far as this collaboration, there is already some early news article about this. And I'm hoping in the next few months, there will be more news coming up, which will mean that we get more adoption of this solution in the U.S. But in the meantime, we are also doing multiple pilots in different countries outside of the U.S. Like, actually, it's really all over the world. Mexico, Colombia, Romania, Qatar, just to name a few countries.
Mm-hmm. Exciting news. Great. Well, I thank you for joining us here on Health Professional Radio this evening. And to be clear, that website is www.vivalnk, VivaLNK.com. Is that correct?
That's right, Neil. VivalNK.com.
Well, thanks for joining us here on the program this evening. It's been a pleasure.
Thank you very much, Neil.
You've been listening to Health Professional Radio. I'm your host, Neil Howard, in conversation with Mr. Jiang Li, founder and CEO of VivaLNK. Audio copies of this program are available at hpr.fm and healthprofessionalradio.com.au.